Hello, my dear students. I'm Dr. Divya DSa. Welcome to my channel Ace Anatomy. Here I break down complex anatomical concepts into simple, easy to understand lessons. Ever wondered how we are able to text, type, or even give a perfect high five? It's all thanks to the median nerve. Excited to learn more about it? Hit the subscribe, ring the bell, and jump right in. Let's make learning anatomy super easy, fun, fascinating, and unforgettable. The median nerve is also known as laborer's nerve. In the laborers, the coarse movements of the hand, which are required for digging the ground or lifting weight, they are performed by the long flexes of the forearm, which are mostly supplied by the median nerve. It is also called as the peripheral eye or the eye of the hand. So this is because it provides the sensory innervations to the pulp of the thumb as well as the index finger. And these two fingers, we use them to see the thinness and texture of cloth or to perform some fine movements like buttoning a coat. The median nerve is formed in the axilla by the union of lateral and medial root of median. The lateral root comes from the lateral cord and the medial root comes from the medial cord of the brachial plexus. The medial root crosses the axillary artery, that is the third part of the axillary artery, to unite with the lateral root in a Y-shaped manner, either in front of the axillary artery or on the lateral side of the artery, to form the median nerve. So the root value of median nerve is C5, C6, C7, C8 and T1 as it receives the contribution from both lateral cord as well as medial cord. Now in the axilla, the median nerve, if you see here, it lies lateral on the lateral side of the third part of axillary artery. It enters the arm at the lower border of teres major. So in the arm, it lies lateral to the brachial artery and then crosses in front of the artery from the lateral to the medial side. So this happens at the level of the insertion of coracobrachialis, that is at the level of mid-humerus. So after it crosses, it runs downwards to enter the cubital fossa. Sometimes the median nerve passes beneath the Stutzer's ligament in the lower part of the arm before it enters the cubital fossa, where it lies medial to the brachial artery and the tendon of the biceps. It leaves the cubital fossa by passing between the two heads of the pronator teres. At this point, it gives off the anterior interosseous nerve. And in the forearm, the median nerve passes downwards behind the tendinous arch between the two heads of flexor digitorum superficialis. About 5 centimeters proximal to the flexor retinaculum, the median nerve emerges from the lateral side of the flexor digitorum superficialis muscle and becomes superficial. It lies lateral to the tendon of flexor digitorum superficialis and posterior to the tendon of palmaris longus. It then enters the carpal tunnel by passing beneath the flexor retinaculum. The median nerve thus enters the palm by passing through the carpal tunnel where it lies deep to the flexor retinaculum and superficial to the tendons of flexor digitorum superficialis, flexor digitorum profundus and flexor pollicis longus and the associated ulnar and radial bursae. In the palm, the median nerve flattens at the distal border of the flexor retinaculum and divides into medial and lateral divisions. That was briefly about the formation and course of median nerve. Now let's understand the same step by step. So the ventral rami of C5 and C6 join to form the upper trunk. The ventral rami of C7 continues as middle trunk and the ventral rami of C8 and T1 join to form the lower trunk. And each of these trunks gives anterior and posterior divisions. Now the anterior division of the upper and the middle trunk join to form the lateral cord, which gives the lateral pectoral nerve, the lateral root of median and continues as the musculocutaneous nerve. Now the lower trunk continues as the medial cord, and that is the anterior division. It continues as the medial cord. And this gives the medial pectoral nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm, and the medial root of median, and it continues as the ulnar nerve. Now the lateral root of median given from the lateral cord and the medial root of median, they both join to form the median nerve. Now let's understand the course of the median nerve. So after its formation from the lateral root of median and medial root of median joining to form the median nerve in front of the third part of axillary artery, the median nerve enters the arm by passing lateral to the brachial artery. And at the level of insertion of the coracobrachialis, that is at the level of mid-arm, it crosses from lateral to medial side. Here in the arm and in the axilla, the median nerve has no branches. It doesn't supply any structures. So from the arm, the median nerve enters the cubital fossa, where it lies medial to the brachial artery. It leaves the cubital fossa by passing between the two heads of pronator teres. And at this point, it gives the anterior interosseous nerve. Now in the forearm, the median nerve gives articular as well as muscular branches. So the articular branch is given to the elbow joint, and the muscular branches from the median nerve supplies all the superficial muscles of the flexor compartment except for the flexor carpi ulnaris. So it supplies the pronator teres, the flexor carpi radialis muscle, the palmaris longus muscle, the flexor digitorum superficialis muscle. And through the anterior interosseous nerve, it supplies the flexor pollicis longus, the lateral half of flexor digitorum profundus, and the pronator quadratus. And the anterior interosseous nerve gives articular branch to the wrist joint and the inferior radioulnar joint. Thus, the median nerve is mainly motor in the flexor compartment of the forearm. The median nerve now enters the palm by passing through the carpal tunnel beneath the flexor retinaculum. So before it enters, it gives the palmar cutaneous nerve, which supplies the skin over the lateral 3/4 of the palm. Once it enters the palm, at the distal border of the flexor retinaculum, it divides into a lateral and medial divisions. The lateral division gives a recurrent branch which supplies the thenar muscles. It also gives cutaneous innervation to the thumb as well as to the lateral side or the radial side of the index finger. The medial division, it gives cutaneous innervation to the middle finger, to the medial side of the index finger as well as to the radial side or the lateral side of the ring finger. So thus it supplies, the median nerve supplies skin over the lateral 3.5 digits. The lateral and the medial division, they also supply the first and second lumbricals. Then the median nerve on the dorsal side supplies the nail bed and skin over the distal half of the dorsal aspect of lateral 3.5 digits. A note on the variations of recurrent branch of median nerve. In 1977, the Lanz dissected 246 cadavers hands and found 29 variations of the median nerve, and he categorized them into 4 groups. The group 1, we have the extraligamentous, here the subligamentous, the intraligamentous, branch from the ulnar aspect and traversing over the transverse carpal ligament. The group 2 included accessory branches of the median nerve at the distal carpal tunnel. Group 3 included a high division of the median nerve at the level of the forearm, and group 4 included accessory branches of the median nerve branching proximal to the carpal tunnel. Now to summarize the median nerve, always remember the nerve has to be described under the following headings. One is the root value, where you tell the root value as C5, C6, C7, C8 and T1. Its formation from the medial and the lateral root of median derived from the medial as well as the lateral cord of brachial plexus. To understand brachial plexus, you can go through my video on the same topic, with the link for which is given in the description box. Then talk about its course in the axilla, arm, forearm and the hand. Then write about its branches. So usually a nerve gives articular branches, muscular branches, cutaneous branches and vascular branches. Also mention about the injuries at different levels and the clinical conditions associated with it. This will be done, the clinical aspect of the median nerve will be covered in my next video. And that's a wrap for today's episode of Decode Anatomy. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends. Hit the subscribe to stay connected with DSa Anatomy. Ring the bell so that you are the first one to know when I decode another fascinating topic. Keep learning, stay curious, and never stop exploring the wonders of anatomy. Until then, next time.